Margaret Martin. I am a registered nurse at a large southeastern pediatric hospital. I've been a nurse for almost 26 years.
What department do you work in?
I work on a unit that is primarily respiratory, pulmonary patients, neurology, neurosurgery, and what they call general pediatrics, and we could take care of any kind of patient.
What do you normally do, like before this, during a shift?
It would just depend on what kind of patients I have. I could have patients from little babies that weren't supposed to be born yet up to 21-year-olds, and I have to do a lot of critical thinking about what might be changing in their condition throughout my shift, and then working with the multidisciplinary team to address whatever needs come up during the shift. And as always, there's just the basic taking care of a child. Children are a little bit different than adults in that you have to, with an adult, it might take 10 seconds to take a pill. With a toddler, it might be a 30-minute ordeal.
So, not as a nurse, but as like an individual person, when did you first hear about COVID-19?
I first heard about COVID-19 either at the end of December or the very beginning of January, about what was going on in China. Probably heard about it through the news or through one of the services that I subscribe to for doctors and nurses.
What was the first like official information that was maybe from like your supervisors of the hospital that was shared with the nurses on your floor?
It's a little difficult to remember. My daughter and I went on vacation March 8th, and I think we came back on the 12th, and I went back to work a few days later, and they were starting to talk about COVID-19. And then within a few days, our supervisors were telling us that we were going to run out of PPE, personal protective equipment. They thought that some maybe visitors, people like that, had panicked and taken some of our PPE that we leave in the hallways. And we were told that this was not really doing much in the pediatric population. So we weren't seeing an influx of patients. We were hearing about what was going on in the rest of the country. And then we had to change all of our rules on how we used our PPE to make sure that we would have enough.
Maybe some people, when it comes to PPEs, that say, oh, well, you just left them out in the hallway. Why do you leave them in the hallway?
We leave them in the hallway so that when we are going into a patient's room that is on isolation, it's easily accessible. Also, I work on a unit where we have a lot of emergencies. We work with very sick children. So, multiple times throughout a shift, we will need to just run into a patient's room. And if the PPE is right there, for example, I will grab a mask. As I'm entering the room, I'll put my gloves on, and another coworker will come up behind me and get me a gown. But if I've got a patient that's not breathing, I'm much more concerned about how quickly I can get in there. So the isolation stuff needs to be outside their room.
So, have you had any COVID-19 patients?
We've had a few, not many, because like I said, it's not happening as much in the pediatric population, and the children are not getting as sick. There is some question right now on if that is going to continue. That seems to be true for like young people, but not necessarily older teenagers into their 20s, which we also take care of that age group.
Symptoms can be less severe with young children.
Mm-hmm.
Would you still advise on taking every precaution with them in their day-to-day life? Because people may say, oh, well, the kids aren't getting sick or something like that, but why is it so important?
I would take precautions for actually many reasons. One, we don't 100% know that they're not going to get sick. There's more data coming out of China that is leading to some questions that perhaps some of this information was not fully reported at first. Also, these children can be what they call asymptomatic carriers, which means they have it and they're not showing any symptoms. However, if they then get around an older parent, a grandparent, a neighbor, someone at the grocery store, they could pass this on to them, and that could eventually lead to that person in a high risk group ending up in the hospital on a ventilator.
What is the biggest change as far as what's going on in your hospital as a nurse from the beginning of all this, when we were just first hearing about it and it seemed like this thing that was way far away, and we were being told that it's going to be fine, it's not going to be a big deal, to now where most states are under shelter in place orders and hospitals are running out of supplies?
So there's a couple of things. For one thing, as far as like our mask and gown, we used to, every time you entered a patient's room, you would put on a new mask, and when you left their room, you would throw it away. You would put on a new gown, and when you left their room, you would throw it away. We had more open access to the kind of mask that they call an N95. And when COVID-19 was first being discussed, we were told that we needed to wear N95 for all these patients. And then it was changed to a surgical mask will be fine, which I think is true. Coronavirus is basically a cold virus, but this one is novel, meaning that we have no antibodies against it. Then we were told that if we did anything that's called an aerosolizing process, which means that they, for example, I suction a lot of babies because they can't blow their own nose. That would be an aerosolation procedure. We used to keep our N95s. We could keep them for most of the day in a bag, as long as they didn't get damaged or wet or anything like that. So most people, if you were in that room for more than a few minutes, you got hot and sweaty and you had to throw it away. Now you are assigned a yellow kind of flimsy surgical mask, and if you needed, an N95 mask for up to 2 shifts, and the shifts don't have to be back to back. And our shifts as nurses last anywhere from 12 to 14 hours. And we're using the same mask for every single patient. So we have a little paper bag with our name and date, and we put our mask in it. No way to say that's staying clean, but that's what we have to do because we don't want to run out. Our gowns, we are putting on hooks on the back of the patient's door. And at the end of your shift, you throw that away. Our employer is being really great in that if you do, for example, we're very used to tearing our isolation gowns off of us, pulling the gloves off, and throwing it in the trash. So it's hard to break that habit. They'll give us another gown. If my mask gets all soggy from getting sweaty, they will give me another mask. But the masks are locked up. They are not outside of patients' rooms. Last time I went to work, I put a bandana in my pocket so that if my bag with my mask was on one part of the unit and I was, say, walking down the hallway and noticed an emergency, I would just grab that bandana and cover my mouth and run into that kid's room and then let somebody go get my mask. This has caused an extreme amount of anxiety for all of the staff, a lot of questions on how this is safe. I think the longer it goes on, there is a more accepting attitude that this is a national emergency and that we would rather reuse our masks than flat run out of them.
What are some major changes in your own life?
Well, I have a history of some very severe lung conditions. They're pretty bad. And I have asthma flares. I have some other health conditions. And as my doctor put it, I have a check mark in every one of the check boxes for the list of who is at high risk for COVID-19. About the third shift, when we were getting patients, when I was working, I woke up the next day and had COVID-19 symptoms, called my doctor. She did a test. Those test results are not back, so I'm quarantined. Those results may not even be back before the quarantine's up because they're taking so long to get test results. I have not been able to go to work. I am now facing a situation where my doctor has said that because of my medical issues, I should not go in the hospital at all. That if I get exposed to this, that I will get deathly ill, end up on a ventilator. I find it very upsetting because as a career nurse, I want to be in there taking care of patients. And it's been pointed out to me, if you get this, you'll end up on a ventilator and you'll just be taking it from someone else. I am going to be taking leave without pay for an extended period of time. And my husband's already been furloughed for this whole month. So we'll figure it out. The main thing is that I have to stay healthy, which is what I think everybody needs to make sure they do. You need to do your social distancing. You need to self-isolate in your home as much as possible. If you do need to go out, make sure you keep a distance in public. I know a COVID specialist who said everybody needs to put a box of gloves in their car. And when you go out, especially things like pumping gas, for example, opening doors into buildings, you need to put on a pair of gloves. And when you come out, just throw them away and then use your hand sanitizer.
In your 26 years of being a nurse, has there ever been anything that this reminds you of at all, like SARS or anything like that, or is this just an entirely separate level?
This is an entirely separate level. I was around through SARS and MERS and H1N1, and there was even another one that was related to just healthcare providers. I remember things being really busy and us working so hard and being super exhausted, but there's never been a time where we were scared we were going to run out of ventilators, where we didn't have enough personal protective equipment, where we really didn't know what was going to happen from one day to the next. We had the adequate equipment to do the job we needed to do. Right now in this country, there is not adequate equipment. I will not be the least bit surprised if we start admitting adult patients to our pediatric hospital, where I guess we might have these 80-year-olds being taken care of by pediatricians. Who knows? But if that happens, we will do our best to take care of them.
The last question is, when President Trump made the comments about hospital staff stealing masks and lying about the ventilators they need, what is your opinion on that?
I do not think that hospital staff, nurses and doctors, were taking personal protective equipment out the back door. That's the way he worded it. I do believe that there was theft. I don't know if that theft was for people that wanted to resell and make profit, which is what he implied. I think there might have been some theft from people that were scared. They were already not being able to find personal things for home use. So they were like, oh, we'll just take this because they can replace it. Like, they didn't realize what was going to happen. It hurt me that he could think that about this dedicated healthcare staff that basically put themselves in situations where, let's face it, they could die, and that they're doing it with inadequate equipment. I don't think that anyone's lying about the ventilators. I think what is scaring different governors is that we have not reached the peak yet. If they're using every ventilator they have right now, then, of course they need more ventilators because this is increasing exponentially. It's like you go to sleep and X number of people have it. You wake up and it's doubled. I think that he really should have thought before those words came out of his mouth.
All right, and that's it. Thank you
Thank
for
you.
sharing.